Thank you. Thank you, Kimberly. I'm the Senior Director at Health and Wellbeing Queensland, the Queensland's state prevention agency, and it's a pleasure to present today on World Obesity Day. I acknowledge the traditional owners and the custodians of the lands across Australia, and I'm on Jagera and Turrbal lands. Next slide, please. In May 2024, Making Healthy Happen 2032 was endorsed as the Queensland Government's strategic response to the National Obesity Strategy. Our strategy adopts the three ambitions of the National Obesity Strategy, ensuring a whole-of-government approach to supporting health and wellbeing across the population. Making Healthy Happen is driving 40 actions in our first action plan over the next 2 years, led by 11 Queensland government agencies working collaboratively across sectors to turn strategy into impact across the three ambitions, namely creating supportive environments by leading cross-government efforts to reshape systems that influence health, empowering people and communities through supporting local solutions and promoting health and wellbeing across the lifespan, and strengthening healthcare by expanding prevention, early intervention, and access to supportive healthcare services. Next slide, please. Through Making Healthy Happen, we're embedding prevention and equity into policy, systems, and communities. As we all know, health is shaped by the environments we live in and the opportunities we have. That's why we're focused on changing systems, not just behaviours, ensuring all Queenslanders have the conditions they need to thrive. Under creating healthier environments, we're making schools, workplaces, hospitals, and communities healthier places to live, work, and play. We're empowering people through community-led solutions and leadership, and we're strengthening prevention in the healthcare system. We are also promoting supportive and inclusive conversations about health and weight, reducing stigma and shifting the focus to system change. And those programs that you see on the slide there are just some of the actions we have underway in Queensland. I'll just talk to a few of those. Pick of the crop. We have engaged more than 225 schools and more than 49,000 students in our healthy eating program that is really encouraging a connection with local growers and farmers to support and encourage schools and their kids to eat more fruit and vegetables. 17,000 families have engaged with our wellbeing app called Pod Squad, which has a focus on creating healthy habits for families with young children to focus on healthy eating, moving, and sleep. Our A Better Choice initiative has seen more than 94% of vending machines in all of our 16 hospital and health services now free from sugary drinks. More than 20,000 Aboriginal and Torres Strait Islander people have engaged with the Deadly Choices program, which is delivered by the Institute for Urban Indigenous Health, encouraging Aboriginal and Torres Strait Islander people to make healthier choices for themselves and their families. And 687,000 people have tracked more than 430 billion steps from the 10,000 Steps program, supporting and encouraging daily movement. These are just some examples of prevention and action that are being driven by strong government collaboration and partnership at the community level. Next slide, please. Health and wellbeing starts where people live, work, and play, and that's why we partner directly with local governments and communities to co-design practical, place-based solutions that create real lasting change. Here are three examples of our work in action. In Bundaberg, the Do Your Thing initiative is a partnership between Health and Wellbeing Queensland and the Bundaberg Regional Council and the Department of Tourism and Sport. This project has been going for over 4 years, and over the last year, We have seen very strong engagement by 89 stakeholders and local health and wellbeing providers across the region, delivering 354 activities to more than 7,000 community members. Wellness My Way is a partnership we have with the South West Hospital and Health Service and the Health Contact Centre in Queensland, piloting a new consumer-facing model of care that directs adults to an online health check, and then it provides a health coaching session for people to develop an action plan based on their health goals. So just over the last 9 months, we've had 290 people in the Southwest, in the areas of Roma and surrounds. So that's about 6 to 10 hours southwest of Brisbane. 290 people have completed the digital health check, and 119 have gone on to complete the model and engage in the health coaching. We are linking people through that program to local, state and national prevention programs, and there have been more than 164 referrals made. And then thirdly, we have had a strong emphasis on working actively with local councils, and we're currently engaged with 27 local councils across Queensland to support the health and wellbeing of their communities. And 22 of those local councils are specifically supporting a priority on Aboriginal and Torres Strait Islander peoples. We have an MOU with Cookshire Council that is focused on this, and we're in the final stages of finalising an MOU with the Gold Coast to strengthen local action there. All of these partnerships are embedding prevention into everyday life and ensuring it's led by the people who know their communities best. Thank you for your time.